All right, y'all. Thank you very much for having us. So I'm representing the Librecorder project. So Librecorder is an attempt to address some of the issues around smartphone-based microscopy, mobile microscopy, or generally point-of-care or POC microscopy. So currently there are a diverse range of designs being explored for point-of-care microscopy, that is microscopy done at the interface where the patient first interacts with a healthcare professional. And so the benefits of such a system are obvious. It could be portable, easy to use, provide immediate results in diagnostics. The data could be shared and portable, and really a variety of uses come from that. So, for example, it can be used in the healthcare setting, but perhaps it can also be used to identify E. coli presence in local water supplies and so forth. And so what we realized when we've started to analyze the space of the design space of point-of-care microscopy is that each design and device is highly localized to a particular disease context and a geographical context, among other constraints. And we started asking ourselves, there are a lot of strengths and weaknesses to the diverse designs, but how do we quantify whether a design is appropriate or well suited to the disease and context it's trying to tackle? And from there, how do we design a microscope that is both generalizable and highly useful? So the first thing we did in tackling that is we took actually a couple of months to identify the diseases that most commonly affect the 50 lowest and middle income countries and segment the clinical workflow of those diseases. So for example, we see malaria at the top, and along with a host of diseases, the first biological sample that is relevant in diagnostics, blood, or abbreviated there as BLD. And from there, the most effective sample preparation technique is smear or SMR, and so on and so forth until you hit bright field microscopy at the end of the tunnel there. And so this is just an overview, but we actually have written a pretty comprehensive systematic literature review of microscope diagnosable diseases and the clinical workflows that, to a very detailed level, that are involved in diagnosing those diseases. So now that we have such a diagram, we now know that point-of-care microscopes need to be optimized for specific clinical workflows. So some of the elements of those workflows include site identification, sample extraction preparation, field of view optimization, sample incubation, diagnostic intelligence, and collaboration. So one example is the very famous now open flexure microscope, which is a 3D printed microscope that has a lot of these capabilities, including things like diagnostic intelligence, collaboration, and network support. But for example, it doesn't have things like sample incubation or the ability to move samples. So we're working on understanding what is the impact of that capability and how many more diseases can be more effectively diagnosed and monitored with the addition of such capabilities. So a second big part of what we're working on in Librecorder is developing a digital apparatus, digital infrastructure to support the use of these wide range of microscopes. We know that such diverse microscopes can be useful in their local context, but they can also be useful in neighboring contexts and maybe even in contexts where a whole different device is being used. So here's an example of what we're talking about. In the health channel of Librecorder, we have a set of data sets and models. These were developed by our volunteers. And so, for example, the dog cells urinary, so cell images of cells from the urinary tract of a dog. I collected these using my open flexure microscope and uploaded them to the site. One of our volunteers developed a dark light sigmoidal classifier, so that gives some characteristics of the relative brightness features on the sample. So one person's able to supply a data set, someone else is able to supply a model, and these work together to develop an ecosystem. So we're developing an infrastructure that allows cohesive intersectional data to be aggregated, and an ever-improving model library, which can be cross-trained across data sets and whose results can then be used by researchers, clinicians, and engineers developing point-of-care microscopes. So along with this, we're working on compiling data related to ecology and veterinary medicine as well. So we're working with local farmers and veterinarians in the context where I live to propagate the use of point-of-care microscopy, especially the open flexion microscope. So the hope is farmers are able to use this to analyze water supplies in their wells, to analyze semen samples from bulls, to make informed and appropriate decisions to support their enterprise. Here in Alabama, I live in a rural community in Alabama. We are working on distributing, like I said, microscopes for use in farms. And one of the things we're looking at is, are there secondary biological samples that are not usually, or that are underlooked or underemphasized from chickens, which could be used to diagnose bird flu? Well, it would be tough to have veterinarians go to every farm and collect all the fecal samples or the drainage and fluid in the eyes from every chicken. But it would be more manageable if farmers could be equipped as citizen scientists to continuously monitor their animals, which they're already doing, but empowered with open source microscopes, which are able to be 3D printed or manufactured quickly, and to help build this ecosystem of biological data. Along with that is the Tallapoosa River that's shown right there. And so what I'm doing personally in part of that is actually traveling the Tallapoosa River and mapping the ecological watershed. And lastly, I'm also working with middle school students there at the bottom who, I don't know if you could zoom in, you might see there's a couple of open flexion microscopes in the back of the room there, but they're actually getting to assist me. So they're able to collect samples from their high schools. So there's 4 rural middle high schools in the county I live in, and the students are creating a map, ecological map of the county by collecting biological samples from those as well.